Issues patients have before they come here are usually loose teeth, missing teeth, painful teeth. When I hear the stories about the patient's condition when they come here, I feel bad that they didn't have an access to good dentistry years ago. But in a way, I'm happy for them because now they're in a situation that they can remedy that and we can make that all better. I love doing the work, and when I see that when I do the work and patients' life changes and they're appreciative and they like it, that what else can one ask for? The way we support our patients throughout the process is, to begin with, we are non-judgmental. Okay, we're not going to blame the patient for the condition they're in. And then every time they come, they see the same people. We support them. My people have a lot of experience helping me doing this. So it's a consistency of care and caring for the patient. How does IV sedation changes the experience? IV sedation is a must in my opinion, because again, a person who has not been to dentist for a while and has a lot of dental work that needs to be done, to ask them to go through that fully alert and feel every little noise and every little touch, it's cruel. It's not feasible. So the IV sedation makes it possible for patients to feel comfortable and go through these procedures. Being the inventor and manufacturer of dental implants, we have it all. We have the best know-how for the implant system we use. We have our in-house engineer. Our engineer is able to select the proper parts for our implants and modify some of them here to fit that patient. The other offices, they don't have the capability of modifying the restorative part in-house. The technology helps the patient by making sure that the best that can be done in the world is being done for them. There is nothing that we have short of the latest and most reliable system that there is out there. The screwless cement-free system that I have developed does not have the disadvantage of the screw holes. Those screw channels have to be blocked with some kind of filling material. Invariably, 5-6 years down the road, some of those blocks come out, they get discolored, and it's just a nasty look, and people get food caught in it, and that's a source of complaint. What makes me happiest to see the patients post-treatment is the fact that I've made a difference in their life. When they're happy, it makes all the fatigue and all the hard work that I put in it all feel good and be justified. The message I have for people who feel hesitant about this kind of work is find someone who is experienced doing this. Make sure the person is the one who starts and finishes your work, and always ask for another person for you to talk to that the same work has been done for. I teach other dentists to do these procedures that I have invented. It helps me to be up to par with the latest and the best that's out there. And of course, if I have to teach it to others, I have to be master of what I'm teaching. So it just keeps me a better, sharper surgeon when I have to train other people to do this.